Okay, guys, we're going to go ahead and start our second panel. This one is called Big or Small, Bird Flu May Affect Them All, Navigating HPAI in Animals. I'm Ronnie Vowles. I'm the communication specialist for Department of State Health Services just in Region 1. Fairly new to public health. I've been here about a year and a half, and it's been such an interesting ride to get started. So unfortunately, Dr. Lee will not be able to join us today, but if the rest of the panelists would go ahead and introduce themselves, you guys can go down the line.
Hi, I'm Dr. Sarah Wyckoff. I'm one of the wildlife veterinarians for Texas Parks and Wildlife. I've been there 3 years actually next week, so I will be handling all of the wildlife stuff.
Buenas tardes, good afternoon. My name is Barb Peterson. I am a dairy and beef veterinarian here, kind of an independent, and I serve, if you drop a pin here and you draw like a 250-mile radius, I serve that area. So it's beef feedlots, dairies, calf ranches, heifer developers, and I helped. I know you might have seen the video that Dr. Abdul showed that there's a human hand touching a cat without a glove. That embarrassingly is my hand touching that cat. So I have worked together with an amazing team of people, including Dr. Abdul, to help solve this mystery of what was infecting our cows. So great to be here.
On that note, I won't out all of my improper PPE moments like you did with your cat, but my name is Dr. Katie Kleinhentz, and I am an anatomic pathologist at the Texas A&M Veterinary Medical Diagnostic Lab, just on the other side of the stadium.
Okay, when we get to our question section, sort of towards the end of this, if y'all will raise your hand with questions, I'll bring the mic to you so we can all hear what your question is. Just to intro, as you may have read, HPAI is affecting more species of animals throughout the U.S. This was discovered through surveillance efforts by multiple agencies. These questions will elaborate on the topic. So our first question is for Dr. Wyckoff. What is the current state of surveillance for HPAI in wild versus domestic bird populations?
All right, so right now, Texas Parks and Wildlife has a hand in both passive and active surveillance when it comes to HPAI. So the main part of surveillance that we do is going to be going out and responding to morbidity or mortality events, outbreaks, concern of HPAI in wildlife. So a call that we might get, for example, one from Wharton County last year was, woke up this morning and there's 100 dead birds out on my land, geese, ducks, etc. So a call like that will come to us, and then we go do an epi investigation at the scene, kind of collect history, look at clinical signs, look at the dead, and then we send any carcasses to our partners at TVMDL. And they will test for AI. So that's an example right there of our passive program, but then we also work with USDA for active surveillance. Every fall, USDA goes out and does some hunter harvest on teals and widgeons and just kind of various birds that are being hunted around the October, November season, and they'll do AI tests on all those. And that's really helpful because not only does that allow for some active surveillance, but also it tells us birds that are not clinical that might be harboring the virus and moving around. Because what we're responding to is sick or dead, but they get these hunter harvests, they're theoretically healthy, right? And so that's a very good collaboration of data right there.
Any other comments on that question? Okay. For Dr. Peterson and Dr. Kleinhentz, how does HPAI affect livestock, if at all?
Sure. So I think that Dr. Abdul did a great job of sharing just some of the images and videos of how that dairy cattle, as an example, are infected. Clinically, they present kind of like how we feel when we get the flu, right? They don't want to eat. They have a really high fever. They just want to rest. They want to go back to their home pen and lay down. So clinically, right, you see a presentation like this, and we really thought it was feed or water or mastitis, right? An infection of the udder, because they all kept popping up with this abnormal milk. So we have we already do routine testing for abnormal milk. We have to because the pasteurized milk ordinance requires it. We start running through all those things. Why are they not eating? We think it's the feed. We start testing all the feed. testing water. And really, we had been kind of down all those channels already. So it was only sadly when the birds had passed away, we had done some sampling there. And then the cats, I get a call from an owner I work for, and he said, half my cats are missing, and the half that I have on the farm are dying. Like, we're finding dead cats every day. And he said, I also have sick cows, can you please come? So it was just this cascade of triaging sick animals and trying to just appreciate everything that was going on. And there's some amazing people on farm. This could not have happened without the amazing surveillance of people on farm, hands-on animals, people that I would call, like they're my doctors, they're my doctoras. They are the ones touching animals every single day on the farm. They're the ones that are making the observations. So that really is kind of the backstory on a lot of the clinical picture. So it fooled us for a long time because it looked like a lot of things that could have been very common.
Yeah, so just to kind of mimic that too is like when you're on farm, and my background goes to, prior to being an anatomical pathologist, I was a herdsman, hoof trimmer. Like, I come from dairy background, so I understand dairy herd management. So when you get the cows that go off feed when they're sick, you have a list of differentials that are going to go through your mind that I gained as a veterinarian. So like she mentioned mastitis. Some of the cows had some diarrhea associated with it. You're not really going to think about something like high path avian influenza that's going to affect these cattle. So back to her and people like her, as well as the producers that I work for, I'm very grateful because a lot of these cows that were originally getting sick and were not coming back from in milk were ending up probably going to processing plants. So we had a handful of very compassionate, maybe passionate is a better word, trying to figure out what exactly is going through the herds in the Texas Panhandle. And so we had two different producers that decided that they were going to bring animals to us for necropsies. And we took care of euthanizing them, and we did the necropsies on these animals because I kept going through thinking, well, it's not a toxin because of the way it's spreading. It has to be something infectious, but nobody can figure out anything that it is. They're not culturing anything from mastitis. They're not getting any of the normal viral agents or bacterial agents that cause diarrhea in cattle. Like, what is going on? So, I came in and I luckily had a pathologist with me. And so the two cows that we were able to actually get at the lab both had they both had mastitis, and they both had generalized lymphatomegaly, which just means that their lymphatic system was inflamed, was very enlarged, and that's telling us that something is working through that body systemically. They had a little bit of GI issues in them, but it was really nonspecific. And when I looked at these cows, like, of all phases that I've been in the dairy industry, I just thought, these cows look septic. I have no idea what's going on with them. And we do the gross examination, which is the necropsy or autopsy, if you're more familiar with what happens in the human side of things. And we really scrutinize this. In my dairy background, the first thing I took was the udder, because I'm just like, okay, you deal with the rest of the carcass. I'm going to go through this udder. And, just seeing the generalized mastitis and then trimming that in histologically. So then you want to look at everything microscopically to look for additional clues. And that wasn't really helpful because, okay, what did I walk away with that from? Okay, we had some generalized tracheitis. That's the trachea that you breathe in and out, like your windpipe. So there was just some very generic tracheitis, no clues there. And that'll come back. I'll hopefully cycle back to that and tell you why that's important. There was some interstitial pneumonia, which fits with like a septicemia or something viral. And then mastitis with necrotizing epithelial, like glandular epithelium, which is like, okay, well, it's mastitis, and whatever is pathogen is in there is killing the tissue, which is what necrosis is. And then when I looked at the lymphatics, like the lymphatics were draining inflammation and also going through like showing evidence that they were being stimulated to do what lymphatics do. Like we take our antigens that we're exposed to, they go to our lymphatics, and then our lymphocytes make antigen to try to combat. But it's very non-specific findings. So that's what, at the end of the day, I walked away from before the cats and the birds were reported to start dying. And going back to the PPE is that, like, this wasn't on our radar. So we weren't wearing masks, something that is a virus that's typically spread and aerosolized. And it also wasn't acting like influenza does in most of the other species that we see. So going back to the trachea and the upper airways, like the way the influenza A typically tends to work in animals is it's going to be inhaled. It's going to go to that tracheal and bronchial epithelium, and it's going to cause necrosis. It's going to kill that epithelium, and then that's the first sign. That's what I was trained for when you sit boards. That's the characteristic lesion that you're going to look for in any animal that is supposedly having influenza A, and that did not happen in these dairy cows. Did it happen in their udder? Yeah, but we never really saw it in the udder, but it was not happening in the lungs of these animals. So that's kind of the story, at least for that, what was happening that I saw as a pathologist with this particular agent.
So the next question is, how did dairy cows become infected? This is for Dr. Wyckoff and Kleinhans.
All right, so we don't really know kind of this is exactly when this happened on this day with this animal, that kind of screenshot, but we do have little breadcrumbs that kind of gave us clues along the way. So the first, cattle detection was February 2024, and with that information, they took the genetic information from that HPAI, the B3.13 in those cattle, and then they also kind of compared it to some historical data of mammals and birds that were infected in that area and also just kind of across the United States. And so back in November 2023, that was kind of the first clue that was found that there was a genotype that was starting to reassort into the B3.13 that we saw. And that was found in a Canada goose in Colorado. Then the next little breadcrumb was another goose in Wyoming that started to show the B3.13 genotype, but with a little bit, still some different kind of genomic changes that wasn't exactly what was seen in cattle. Then the next little breadcrumb was a peregrine falcon in California in mid-February 2024. And then we saw a mammal, and that was detected in New Mexico, also in February 2024. And so far, between that skunk and one of the first geese that was found, those have been the closest relations that have been noted for the B3.13. And that's just, again, of samples that have been available and were able to be utilized. But that's kind of missing link is still unknown, but it does build that kind of background picture of we do see movement across the United States in these migratory waterfowl, the Canada goose, along the same flyway, the central flyway. And then now we see the skunk in New Mexico, one of the first states around the time that cattle were also found to be infected. So that's kind of the puzzle pieces that have been put together so far. Whether we'll actually know exactly what happened, we might not know, but this is kind of so far what we have been able to get.
As I mentioned earlier, typically you're dealing with a pathogen that spread through aerosolization. I guess recently the USDA did a study in some calves that were fed infected milk. And so they took these little dairy calves and they drank milk, and then they followed them. I don't really understand their whole study design because I didn't go into that details in the reading. But basically they were able to find out of nasal swab influenza in calves. And I don't think that these calves had any clinical signs associated with it when they found Are you familiar with that?
Study?
Yeah, in the
Yeah,
study.
it was just like mild respiratory disease, right? They might have had some mild like nasal discharge. Maybe they had some matting of their eyes, if I remember from that paper. Really, really mild.
Yeah.
Yeah.
But typically what happens in the influenza anyways is it's going to come in and it's going to attack like your upper airway. But within 72 hours, usually the virus is moved on past the lung if that's what's going to happen. So if it has been infected, and I don't think that we have all of the research yet about like the studies that are going into animals that were infected and necropsies done at like the other USDA like level laboratories, to know like what is happening in those first moments depending on how they spread, the organism. At least from the respiratory, it seems to take off fairly well in the mammary gland. And back in my days when I was on farm doing like milking equipment evaluations and stuff like that, I mean, it wouldn't surprise me if there was any cow to cow transmission from contaminated milk in the milking units. Now, I don't know that that has been proved or disproved or whatnot. It's been talked about, but I just remember back of my days of either milking cows for a living or managing people who were milking cows. Those are the types of things that I think about, let alone birds that are in the barns. I haven't found a bird-proof barn yet.
I'll just add to that really quick. If you are in this area, then you understand that a lot of our dairies are what are described as open lot. So that means that the feed components, the water, the animals themselves, everything's outside, right? We're all exposed to the elements. And even if you have a more confined system, oftentimes your feed is still outside. So all that is constantly exposed to birds and rodents and pick a critter, right? So there unfortunately is the potential here, like Dr. Wyckoff mentioned, the different species that were identified, those could have easily accessed the feedstuffs and the water that we are using to feed the cattle and that they drink from.
Yeah, and just a reminder too, for wild animal transmission, it seems to be kind of falling into three main categories if you exclude the seals and sea lions down in South America. But basically it's going to be kind of bird respiratory excretions or secretions, so sneezing, coughing, watery eyes, but then also feces is very infectious, more infectious probably than respiratory. So again, birds that are pooping in water, pooping on the ground, things like that, that's a very easy transmission point. And then also infected carcasses, which is where a lot of our scavenging mammals and birds are getting sick because something succumbs to HPAI, and now it's an infected carcass with a lot of viral load that can be consumed. And cows, they love to lick everything, I feel. So another opportunity right there for transmission.
Okay, that'll lead to our next question. What steps should small scale or backyard poultry owners take during an HPAI outbreak? This is for all of you.
I'll start with probably I think is the most simple, just like we talked about feed and water access for domestic animals like cattle. Think about if you have backyard birds or you work with other poultry or you work on a dairy or you work with other cattle, there's risk unfortunately there, not only from birds that may be migratory or in your environment, but also the animals that you work with, right? So it's just like, I think of it as the simplest things. At the time I had animals at home. So it's like, I come home, I decontaminate in my garage, right? Take all your stuff off. Don't drive your vehicle over near them. Limit who visits your location just for the pure sake of you don't want people driving around. Obviously this is your home, but things like that. The other thing to think about is, clean footwear, clean gloves, and just be mindful about this. Is just try to protect your animals. There's recommendations I know to try to keep them contained, keep them inside and limit their exposure to other birds as well.
And from a wildlife standpoint, a message that we kind of always continuously preach is keeping wildlife wild and creating that kind of healthy boundary separation between wildlife and your own pets, your backyard flock, anything like that. We live in a world where we're expanding wildlife and human interactions, and encroachment happens every day. but doing little things that you can, as securing your food supplies, making sure that your waters are clean and it's not an area for wildlife to come congregate, doing, health checks on your animals, also just keeping an eye on what's happening in the wildlife around you, reporting to your local biologist if you do notice something unusual, sick or dying animals. All those little things can help protect wildlife, can protect you, and can help protect your backyard flock as well.
I think that the controlling the wildlife interface has been addressed, but the other thing too is that you have to think about for your backyard flock and yourself is that don't be buying from vendors or places that have sick birds. Like I've had people that like, oh, but like I got this bird and it wasn't doing well and I felt so bad for it, and I'm just like, oh, I get it, but like it's not a good idea to do. And so the other thing too is if you're bringing in birds like to expand your flock or whatnot, quarantining like what you're bringing in and watching it for a set period of time, being concerned about like, am I wearing appropriate PPE, especially if you're dealing with sick birds. I mean, now I don't go out and approach all my critters that I have at my house wearing like a Tyvek suit and latex gloves or whatnot, but like practicing good hygiene and like containing, like if you've got outside clothes or outside shoes, I come in and first place I go is my garage, and that's where my farm shoes stay, and then I go in the house and I wash my hands because I don't have an outside hand washing station. But and if you've got something that's suspicious, call your wildlife office, call your public health office, call the diagnostic lab, and if it's something human related, the diagnostic lab will point you away from us to where you need to talk to. But if it's something about testing animals or whatnot, like, and what to submit and if you should submit, that's why we have people, either pathologists or diagnosticians at Texas Veterinary Medical Diagnostic Lab, is to help address those issues, or call your vet that you're working with that does your normal routine healthcare stuff, and get them involved.
The only thing I'll add real quick, Dr. Bell mentioned this, it's just so difficult. I'm thinking about California circa 2.5 years ago is encouraging people to report when this is happening. Because unfortunately in poultry, the outcome is euthanasia in an infected flock. And so understanding that outcome, it can be very, very, very difficult to encourage people to report when they have sick animals. So I think it's then you just try to funnel everybody back to, okay, biosecurity, try to keep your flock as safe as possible.
Okay, for Dr. Wyckoff, what wildlife species are most at risk for HPAI, and how can conservationists help protect them?
So when it comes to wildlife, HPAI can affect terrestrial mammals, aquatic mammals, and of course birds. And so what's been really interesting about this strain is historically there hasn't been AI detected in wild mammals, definitely not to a capacity like we're seeing now, where it feels like almost every couple months we find out some new mammal specifically has been infected. And we're talking detections in mice, rabbits, skunks, foxes, raccoons. There's been a polar bear detection up in the north, brown bears, black bears, dolphins, seals. I mean, it's substantial and creative, but also alarming, because this is all unknown territory, right? We don't know what any of this means, what it's going to mean for the future, and how all these different animals are now pathways for reassortment and changes for this HPAI. But as far as kind of what's most at risk, so when we think of birds, we're going to think of our scavengers, so animals that eat infected carcasses, your vultures, raptors. Eagles are very susceptible. They, despite having their big talons and large beaks, they are very well-known scavengers. That's also going to include like your hawks, red-tailed hawks. We've had a bunch of those in Texas come up positive. Migratory waterfowl, of course, they're the ones that are going to be migrating, going to new areas, picking up disease, spreading disease, and depending on the species, some of them have the capability to be non-clinical. So for example, those teals that I referenced earlier that are hunter harvested. Shorebirds, so your little seabirds, your little plovers, things like that. Gulls, ravens, also very susceptible, and then your pelagic birds like your pelicans. So in Texas, we've had a lot of geese, especially up in the Panhandle area, a lot of cacklers, a lot of Canada goose, snow goose have been affected in those areas. You move to the coast, Houston area, that's a lot of our seabirds, lots of pelicans. And that's also kind of where we keep an eye on potentially dolphin mortalities as well. And then right now along the I-35 corridor, we have a very extensive black vulture outbreak, essentially from North Austin going all the way down into San Antonio. And what's really unique about black vultures is, we've seen them all, they're in their giant groups, right? And so they also can feed on one infected carcass. That's 5 birds right there that have been infected, right? But then if one of those birds dies, they will actually cannibalize and eat that bird. And so now that one bird can infect even more. So it's a continuous cycle in some of those black vulture flocks. And as far as mammals, so mesocarnivores are going to be the ones that are most susceptible to HPAI. And again, a mesocarnivore, it's kind of urbanized, it's a scavenger, or primarily will use scavenging when it can. So raccoons, skunks, foxes, coyotes, and bobcats would be kind of the top 5 of those. But as I mentioned earlier, it's gone everywhere from ocean animals, small animals, to bears and other large cats. For whatever reason, cats in general, whether it's wild or domestic, have been very, very susceptible. With domestic cats, pretty much almost all of them dying when they get sick. And so that's really interesting as far as kind of the conservation question, because unfortunately, there's not a lot that can be kind of done about HPAI, just in the sense of there's such a large free-ranging population of wildlife, right? There's not the capacity to go and respond to every sick animal. So a lot of what people can do for conservation is learning about HPAI, just like what you all are doing right now, learning about the steps that you can take at home to mitigate disease coming into your flock, spreading out, teaching others about HPAI, also very important. Knowing who to contact, whether it's wildlife or Texas Animal Health Commission, USDA, DSHS, if you do have any concerns, let us come and help you. That's our jobs. I know Dr. Reed and I, we have many conversations with people where we're like, please don't take the sick bird into your home and try to nurse it for a week, with your backyard chickens, your kid and your cat. Like, we are here to help you. So just teaching people, who to call. Also, the next 2 things are kind of hot topics, but not feeding wildlife or doing things that allow wildlife to congregate. That's a really difficult part, especially in these urban areas, like in Austin. That's where I live. People love to go to the lakes. They love to feed the ducks. They love to see the ducks. But unfortunately, when you're doing that, you're allowing all of these animals to congregate, density, they're pooping everywhere, and that is just a really nice way for HPAI to spread. And then now we have humans in there as well. And then the last thing too, just something as simple as kind of keeping cats inside, especially if you have a cat where it just loves to go outside. It will be fine inside. It's safer for it inside because not only again, cat's very susceptible. So if your cat catches a bird and it's a sick bird, it's easy to kill. Now your cat can get HPAI and will more than likely 9 out of 10 times, made up statistic, will die from it. But now, this cat's outside, that cat has died. And then what did we talk about with the vultures? They're going to come in and scavenge. Now you have those 5 infected vultures off that cat. And then that's going to go to another vulture in that flock. And it's essentially a giant ripple effect just from one cat. So little things like that can be done to help all of us as we're fighting HPAI right now.
Great. Our next question is for all of you. How can interagency collaboration be improved in future HPAI outbreaks?
Well, first of all, I know what it's like to be frustrated when you don't know an answer. and I can tell you that high path avian influenza was certainly not on my radar until the dead birds started. And then I'm like, well, maybe we should test for, and then boom, there it was. So that's just where we're at with that. So as a diagnostic pathologist, the first thing I have to do is I have to go through and I have to rule out like common diseases. Don't look for the zebra immediately. Get rid of all the horses and then let whatever surface. So I think in the beginning we were working with our field veterinarians, as well as we knew more information. It wasn't at my level, so I'm speaking a little bit out, but at least at my agency level, they were speaking to other agencies. They were speaking to the Texas Animal Health Commission. They were talking to the wildlife. They were talking to the health departments and things of that nature. So that's one thing that I think we were always kind of open to discuss amongst the agencies, and maybe that didn't always get out to the general public, but I feel like our agencies were always working together. Now, at my particular organization, we are not a research-focused institution. We are interested in finding and diagnosis and helping, support animal agriculture, animals in general, animal health in general, but animal agriculture is a big reason why we are here. So when it got to me, it was much more important for me to find an answer than it was to worry about publishing this information that we have, because there's other institutions that, I have worked for or worked with, and their common goal was to get this out into the press as soon as possible, which is important. I mean, the story has to be told, but when you're in the middle of we're just finding out, with animal agriculture in this nation, I mean, you go and you say something like this, and this could have major trade implications. This is above, the Texas Panhandle agriculture. This is national, this is global information that is going out. So really working and making sure that what we're seeing and the story that we're telling is the appropriate story that should be told, because of the implications that it has for us as a nation, as well as what is going to happen in the world. So that's just my story. I have always seen people working. I've always seen people working with the various agencies. My agency is not allowed to call a positive test. We go through and we do the testing, and if you have received a report from us, it will say a non-negative test, because that has to go to the USDA for a confirmatory test. We do not do that at our laboratory. That has to go to a national laboratory to do. And so that gets lost in translation. I think that the public doesn't understand maybe necessarily all the steps that we have to follow to actually get a positive diagnosis. But I've never not seen us as an agency withholding information from any of the other agencies. I've just seen dedicated people going to meeting after meeting after meeting after meeting to try to get to the bottom of it, to help those people out there who are dealing with it. I mean, because I'm on the outside now and just look at it, but I was a producer, that would be devastating to me. So that's my view of it. Not necessarily TVMDLs, but I did see a lot of people at TVMDL working very hard with the other agencies.
So I think initially there has been ongoing a lot of collaboration, like Dr. Kleinheinz mentioned. The lab immediately responded when we said, as a group of veterinarians, imagine there's about 12 of us, hey, something really, really weird is going on, right? And we had submitted all these samples. We got this case definition. Okay, we're going to work the problem. Reached out to our state veterinarian, Texas Animal Health Commission. Okay, we're going to work the problem. We don't know what this is, but we're going to work the problem. And I'll never forget, I need to tell this story very briefly. The weekend, so I had sent samples to Texas TVMDL and to Ames, Iowa, not just because the lab here was doing a great job. They had a ton of samples. I had talked to a pathologist up there as well. I said, hey, I want to send you some too. Both labs are running samples at the same time, and they both reach the same conclusion almost the exact same time. And I get that call, and I have that call. It's a Thursday night. I'm home. I'm like, oh gosh. So I get a call from the USDA, and they said, please hold onto this information. We're going to do a press release. Okay. That weekend, and this is me as a private practitioner, I serve my clients, right? I serve my clients and I serve the people who work for them and the cattle they care for. Okay, I get calls from the FDA, the CDC, USDA National Vet Services Lab, and I'm thinking, okay, so in 2009, I went through this training, which was on foot and mouth disease. So in my mind, I'm like, oh my gosh, okay, they're gonna activate some type of plan, because we're so overwhelmed. I'm spending every waking hour at that point drenching cows. I'm drenching cows and giving people relief. This is my life right now. I'm drinking a lot of Dunkin' Donuts iced tea. This is what's going on. So the point of all that is to say, after that, things got very, very funny after the diagnosis. And understandably, we're in a post-COVID world. There's all this fear about, can we still sell our milk? I don't want to be identified. Every agency has their own priorities, right? Whether it's food safety, safety of beef, safety of milk, pharmaceuticals, you name it, every human health. And like Texas DSHS did a great job because they immediately responded and said, hey, we're going to try to do pop-ups. We want to meet you where you are. So it was a ton of chaos. And I think no matter what, like everyone has a plan. What's Mike Tyson say? Everyone has a plan to get punched in the mouth. I mean, that's getting punched in the mouth. So at the end of the day, I hope that we can have a debrief about this as a One Health, a public health team, and really get feedback from everyone to understand, okay, this is what we did really well, and this is where we fumbled the football.
Yeah, I guess kind of continuing along that note, H5N1, it's like a box of chocolates. You never know what you're going to get, I feel like. And that's kind of what we're finding out with all these mammals, with cattle, with all the wild bird detections. I mean, compared to the last big avian influenza outbreak in 2015, there was 57,000 wild birds tested and only 98 were positive. Now we have just detections, 12,000. And that's a huge underrepresentation of what's actually out there. And mammals, we have a few hundred too. And so I think just the fact that this is so kind of mysterious and new is throwing people for a loop. Throw the food supply in there, you got another huge loop, and then you have post-COVID fatigue, and it's just kind of overwhelming in that capacity. And so I think, unfortunately, it's a disease where there has been a lot of scrambling, but a lot of, at least my experience in Texas, we've all come together to help each other and help, share information, figure out what the other's doing, see how we can assist with another. Like I know recently Texas Parks and Wildlife and DSHS we're discussing doing some more kind of retrospective testing of mammals all throughout Texas and seeing what we find there. We talk a lot with USDA as well, see what we can do for them. Again, do you guys want to go hunt or harvest in a different area? A lot of that collaboration has been super important, and hopefully, we don't have a lot more surprises thrown our way, but it is nice to have days like this where we all can kind of come together, talk about it, meet each other, and continue to build those partnerships and relationships to invest this disease as it evolves and we evolve with it.
I do think that there is some diseases like foot and mouth or African swine that is on our radar. And I can tell you, influenza was not on our radar. I think we would have been better prepared with one of the other bad guys.
Okay, this is
Well, just
ahead.
to add on that, sorry, and I say that because of testing validation too. So like when you're in the laboratory and you're running samples, you can't just run samples on tissues that are not validated, because every single analyzer that we have in the lab has a protocol, and it has a protocol for certain tissues that it's validated against. So if I pick a tissue and I run a test for it that tissue hasn't been validated for, what does that really mean? So the other thing, going back into like the agency talking, is that if you don't have a test validated to run on a specific sample for a certain disease, I mean, then you have to wait even longer. And if you're dealing with something that wasn't on somebody's radar in a species that wasn't on somebody's radar, I mean, that turnaround time will feel like forever if you're on the other side of the equation, and even if you're on the right side of it. I mean, it takes a lot of time to validate tests so that we're not leading with false information.
So the last question that I have now is for Dr. Peterson. What are the biggest challenges in applying One Health principles on the ground in rural or resource-limited communities?
Good question. I think the first thing to start out with is probably everybody's expectations sometimes versus the reality. And I think the previous panel did a great job of talking about this, understanding like I live in a world where humans and animals are together every day. And those folks and myself and others that work with animals are at risk. It says understanding what are the barriers to making sure that we have healthy people, healthy cattle, and a healthy environment for everyone to live in. So if I think about that right there creates a whole set of challenges just for supporting sick humans, right? We had a lot of sick humans. How do we support them? It came down to a lot of one-on-one relationships and a lot of trust. And the thing I think that's the most challenging is whenever we're met with a situation we're not familiar with, and then we are going through what the stages of grief as you go through it, it's like denial and anger. And those, unfortunately, were probably the top two emotions that folks that were frontlines received at that time. And I get it. I was scared as heck. I'm not going to deny that at all. So those two emotions kind of drove people's behaviors at that time. As veterinarians, we take an oath and we take it seriously, where it's like, we're going to protect the animals that we care for. We're going to always be continuously learning, and we're going to promote public health. So it's like, you think about that. We're in this space all the time. And when you feel like every you're in this, I call it being in the middle of a grilled cheese sandwich where like I'm the cheese and the bread is like pulling on you from both sides. That's kind of how it felt, because I understand the interests of my clients. I understand the challenges they face with their businesses. I understand the humans that I work with. It's just trying to bring all that together at once. So I think managing expectations is just a really big part of this. And I wanted to look because I had made some notes about this because I wasn't sure if this question was going to be asked. But really, the other things to think about are, as accredited veterinarians, we are kind of tasked with, we're supposed to be the boots on the ground and the eyes and the ears. And we take that seriously also, kind of back to the oath and thinking, okay, now that we've made these observations and helped to solve this puzzle, we're going to get support. And at times it was very, very limited. And I don't know all the reasons for that. I know a lot of the agencies are strapped. But I think about the other regulatory things we work on, think about tuberculosis, think about brucellosis. We have resources, we have a plan. We kind of need to get to that stage, because even as we stand right now, Texas as a state, this is not a reportable disease in the bovine species. So it puts me in the most awkward position you can imagine. If I see clinical signs that I think are consistent with this, for other things, we test. Now it's like, oh goodness. It's like, okay, well, I can't write you a health paper. These animals can't move. They have to be tested before they get moved. All these challenges, right? And I realize that talking about trade, there's some really big implications to thinking about changing the reportability of a disease. But gosh, we've had a year. I don't understand that, and I've been advocating for that. The only other thing to mention, sorry, I just want to look at this note so I don't forget anything. Unfortunately, it really eroded trust. And I know this was talked about in the previous panel, how folks in public health, like we would love to be in a position of, hey, we're coming to you with sound information, sound advice based on science, based on experience, based on the outcome that we predict will happen. And there was just this crazy erosion of trust with people that we have worked together with for a long time. And that has been slowly been built back up over time. But I mean, that weekend, some of the clients were like, you know something and you're not telling us. It's just that little seed of doubt that you never ever want someone to feel like, hey, I have your back, I understand what's going on. It's just that challenge, that trust, right? Trust is everything. If I don't have trust, I have nothing. So this really put trust to the test.
Any other responses to that question? Do you have any questions from?
Sorry, let me just follow up really quick with
Okay, yeah,
the One
sorry.
Health thing. So just following off of One Health. So, I think it's come more to attention now, but for a long time, wildlife was kind of the forgotten disease field. And now we're realizing that wildlife is actually the sentinel for disease. I mean, there's COVID, HPAI, Hendra, Nipah virus, Ebola, the list goes on and on. And so I think, creating One Health, promoting One Health, and showing how it is all tied together and building trust between all three of these categories, agricultural, people, wildlife is really important. And like you were saying, people get angry, people get afraid. It's scary out there. It's a very chaotic world when you think about diseases. And so being able to have those partnerships and being able to lean on each other during those scary times is really important and helpful for all of One Health.
Absolutely. And this is like a really calm, nice place to talk about this, right? If I think back a year ago, it's just like everything is chaos all the time. So it's great to be here and have this conversation in a nice, calm fashion.
Yeah, thanks, guys. All right, right over here. I'm bringing you the microphone.
So first of all, thanks for coming and chatting, and it's always good to be able to put names with faces, and so really appreciate y'all. I was going to ask, so and this would probably be more along the wildlife standpoint. So is there any active seroprevalence studies that are going on, either with the hunter harvest or in specific wildlife populations, whether that be waterfowl? I know that certainly there's, if you're just looking for H5 in general, then we might end up with some really large numbers, or active seroprevalence studies in other animal populations, realizing that there's a lot of technical difficulties in that, both from a lab standpoint as well as sample collection. But anything that is going on there?
Yeah, so there are some ongoing projects right now, specifically with Texas A&M, checking at seroprevalence in mammals and birds in parts of Texas. Some of those are focusing up in the Panhandle area, where, of course, our dairies have been affected mostly, and some are scattered a little bit more kind of in the brush country. But otherwise, that has been going on. And then recently, just kind of in general, wildlife health committees and other state agencies, there's been discussion about testing deer for HPAI seroprevalence. And so that probably is coming up next on the list.
More questions? Oh, sorry.
I have two questions. One may be easier than the other. So let's start with the hard one. Dr. Peterson, you mentioned that trust was lost. And I know, at least in central office, we knew that. I'm wondering, and there's probably not one single answer to this, but how do we as public health professionals reach out and build that trust before and after an event like this? I know, like, personally, one of my frustrations was, we were attacking it from a perspective of, we're just trying to help you guys out, right? And I know, like, there's a lot of parts to the story, but it was frustrating to get pushback from ranchers and places that didn't want to participate because of some of the issues that y'all talked about. So I'm just curious, as someone that really interfaces day to day with that population, like, what are your suggestions to us?
Yeah, the good question. And I do think it's hard, right? I think it was mentioned on the previous panel how independent everyone is. And there is a kind of an inherent fear of distrust of the government, kind of that sentiment going on, especially in a post-COVID world. But I always think about bridging. So you think about the allied professionals that serve the industry, myself as an example, as a veterinarian, but there's groups of people that serve the industry that it's it's not their business, but they support it. You know, think about nutritionists, think about other consultants. Lots of people are supporting the dairy as an example. So I always think about bridging, and I feel like that the DSHS team did do the best job they could in the time to try to bridge. And the other thing I think about is there was so much unknown. That's the other thing. There was too many unknown variables in that moment. I would get people to commit to go get tested, and then they're like, no, I'm not. I was like, I will go there with you. Like, I'll do it with you. No, you know, we would get ready to go. Oh no, I can't go. You know, so it's just that it's the fear of, if I am identified, what is the outcome? Now, I mean, it's way more free to talk about it. You know, this is a whole year after, so much different. But at that time, unfortunately, yeah, widespread fear. So I have the pleasure of working with Migrant Clinicians Network. We're having the exact same conversations that you're having as how do we do this? How do we reach out to a community and support even a community that way as well? Same thing. I think it's trusted advisors, trusted peers, people who have relationships and bridging. And I welcome any other feedback about that.
Thanks. Dr. Wyckoff, the second question is for you. You mentioned all these new animals that we're finding avian influenza in, and I'm just curious, you know, is that because we're looking more, or, you know, because it's kind of the topic of the day or the year, I guess, at this point. So I'm just wondering, like, how much of that is actually, and we may not know the answer to this, but how much of it is real, a higher prevalence, and how much of it is just, oh, we're actually looking for it now, or we're attuned to these things, and we have concerned citizens that are turning in their animals and that kind of thing?
So yeah, that's a good question, and it's, you know, hard to say 100%. I do think, though, because we kind of fell into these detections, that it wasn't really, you know, an increase in testing or an increase in testing capacity, because we weren't even thinking that this was going to be a problem. And then all of a sudden, you know, in Minnesota, rehab center had like 5 sick foxes or something like that. It's like, oh, okay, you know, maybe a one-off thing. And then all of a sudden, no, there's dolphins in Florida. And it kind of kept continuing from there. And a lot of, you know, all of these detections, they're all clinical, so they've all presented at some point. And I still think they are underrepresenting, yeah, what's actually out there. With these mammals too, kind of what Dr. Abdul was talking about earlier, like your skunks, foxes, raccoons, if you see a neurological one of those, your first thing is probably rabies. And if you're a landowner, you're just going to shoot it, and that's it. And so how many of those animals potentially, yeah, in the past could we have been missing? Something else, though, about this H5N1 strain that I was reading about, compared to kind of like the last 20 or 30 years of avian influenza, is that this is a long stock neuroimmunidase, and that hadn't been found historically. Again, I think in like the last 30 or 20 years, and there has been some type of data or some research showing that that long stock neuroimmunidase does increase pathogenicity and has the potential to like hit some more of those mammalian receptors. So that could also be a part of it too, just that evolution of that long stock. But otherwise, yeah, I mean, it definitely, you know, could we have missed animals in the past that we thought were rabies or distemper? Yeah, but with the range of animals and how they've been presenting, I think we would have seen something like that historically if it was like this.
Right, I got a question from here. So with respect to the dairy production, so my question is, what's the place of education for the dairy farmer, you know, with respect to the trust? That's one. And also with respect to vaccine, right now people talk about vaccine hesitancy and also the acceptance. So the place of education, and with vaccine, assuming we have a vaccine today, a candidate vaccine today, what's likely to be the acceptance with respect to any economic implication with the use of H5N1 vaccine in dairy production?
It's a good question. So the first question is about education, right? Where can people find more resources? So like for the state of Texas, you have Texas Animal Health Commission. You've got that at the local level. You've got the USDA resources. National Milk Producers website, NMPF, is actually a really good website with a lot of resources for biosecurity, for testing, for some of the milk indemnity is on there as well. So those would probably be my top 3 stops for websites to look at. And I'm sorry, the second part of your question is about vaccinations, right? that vaccine?
Yes, so
Okay.
if there is a, let's say we have a candidate today, so from dairy farmers' perspective, are there any likelihood of pushback or acceptance? Are they willing to accept the vaccine? Or would there be any economic implication to the use of H5N1 vaccine?
It's a great question. So what I know is pretty limited. There's some vaccines in development right now. I don't know what the trade implication could be on beef because a lot of dairy cows have a second career as a beef animal. So I don't know that. And as far as acceptance, that's a great question. I really don't know. I really don't know. We obviously have accepted vaccines for previous pathogens that we use widely. Some of those technologies are different, some are the same. But I tell you what, the things that we're talking about on the farm right now is how to better support the immune system, how to decrease stress, how to feed a more consistent feed. What can we do when our cattle are younger to try to prime their immune system? That's kind of what kind of the neat side of this is. That's where this discussion has led to, is those types of thinking on building a better, healthier animal to begin with. And I say building in the sense of animal husbandry. I don't mean that in a weird way.
Okay, I see ya.
Hi. My question is, how can necropsy protocols be adapted to improve viral detection, specifically in feedlots or like dairy, but in the field? And like what the settings and what samples we should like take to maybe help to detect?
Well, I love to talk about necropsy stuff, and I actually did a whole podcast for TVMDL on like collecting tissues and whatnot. So I have from that, our wonderful media outreach person went and made a whole list of comprehensive tissues. So, I mean, I'm not going to rattle them all off now because, I mean, I always tell people when I go into a necropsy floor, I have to have a very specific necropsy order so that I don't miss anything. Because it's very easy to open that animal up and see lesions that, if you're someone like me, makes your toes curl and you get so excited and then miss something that's obvious. So I think sometimes, like with the mastitis, like how many people really get excited about mastitis? I mean, I do, but like people that are like, it's mastitis, I deal with it every day. But like that's where our answer came from. So I mean, usually what I do is I sit down and like I said, I have to do it the same way every single time so that I collect all the stuff, because it's very easy to get distracted by that. And because I've done this long enough, I've missed things or thought I collected something and didn't collect enough of it. So from previous blunders, that I just have a set. So I would get a specific SOP and I would go through it every single time. If it is something that you think is infectious to the point that you don't want to open it, then send it to a diagnostic lab, because we're perfectly like capable of handling stuff. Like my lab, under normal circumstances, is a BSL-2 rated lab. So you have to wear PPE going into my lab. It can easily convert into a BSL-3 if I have to turn it into a BSL-3, because like we open something up and that's what we think, or if something's coming in and we suspect it. So first of all, it's always safety, PPE, and then collecting tissues fresh and fixed are like what I always like harp, and take pictures of it. So be very methodical, collect the same stuff every single time, commit to doing it so that you have the stuff to test for. I can't tell you the number of times, and this isn't with influenza, but like that people will send in for neuro cases and it's like, okay, well, where's your neuro tissue? Well, we didn't give you the brain. Okay, well, we'll see what we can find with what you've given us, because it's too late. Remember, I used to tell the fourth years, I used to work with fourth year veterinary students, it only dies one time. And in most cases, it only dies one time. And so don't mess it up by don't collecting it. That's the only way you can mess it up, is that I'm not I can't fab a carcass. I would make a butcher cringe, but at least I've got the tissues that I can test if I need to. So it's not about beauty and like dissections. It's about getting the appropriate stuff, getting enough of it, because it's easier to throw it away because you can never go back and get it.
I'll just add to that, if your animal is producing milk, milk is the #1 sample that we can collect. I think Dr. Abdul showed this as well. Some urine samples were positive and some nasal swabs, and they make those, it's like a uterine mare culture swab. It's really, really long, a deep nasopharyngeal swab. We tried those, we tried nasal swabs, kind of mixed results, not great results. And then of course, if an animal has passed away, thinking about a cow specifically, right? Yeah, shoot, I would grab a full tissue set, grab everything. Lungs, liver, heart, spleen, kidney, all the GI, brain. Oh, heck, get the brain out of there. Get the brain out.
I've got a fantastic one cut method to get the brain out.
She should show you this. Anyway, yeah, just take a full sample set. That way you can, our rule outs too, if you think about our Santa Claus list, it was so big. So it's like, okay, if I on accident forget a piece, I might have missed that piece of my Santa Claus list on accident just because I forgot the piece. So
there was a time where my wonderful diagnostician that couldn't be here, who probably really should be here giving you this talk, and she was putting so much pressure on me because she really thought it was. And it's like, I don't know what it is. All I know is it's nothing that you keep wanting it to be. So, yeah.
Thank you so much for coming to speak to us and sharing your knowledge today. I had a question kind of about feedlot cattle. How come you don't see an impact on them? Is H5N1 just for lactating or nursing calves?
you can answer that.
Okay. So, one of the things that I think about in dairy cattle is that we're monitoring them 2 to 3 times a day on a regular basis. Some places are doing it more than that, but they're going to a parlor and they have a parameter that we're checking. And a lot of the technology has improved to the point where they're wearing ear tags that are taking their temperature. They're wearing activity monitors. They're wearing like rumination monitors. So there's all of these things that are happening in the dairy world that I don't know how much of that technology is translated into the feedlot world. So at least from a monitoring standpoint, we at least have some criteria to select sick animals off of. If you had a respiratory case that was in a feed yard that wasn't doing very well, you're gonna probably do a poll on it and run it up to your treatment chute and go through your respiratory protocol. So do you know what it is? No. So are you likely going to catch it if it's high path avian influenza? My guess is probably not, because I think that one of the big things that led us to is it just kept happening in these cattle, and when they're getting milked, you have that set data that people would show me. This is what their activity was doing. This is what their rumination was doing. And I don't get to look at all that fun stuff anymore. So I was really excited when somebody shared it with me. But like, unless you're doing that with like feedlot, I mean, who knows? It could have easily been missed. I wouldn't think that it would be something specific to a dairy cow or a beef cow. I just don't think that we had the parameter to find it.
Just to add on that, one, I think Dr. Kleinhans did a great job of talking about this. Most cattle are managed individually on a dairy, but they're managing groups or pens, right, on a feed yard. That's one parameter. So if their feed intake goes down, it may be more difficult to tell that potentially. We see that because we see feed presented on a flat bunk, and then we go and we get refusals every day for most of the groups. So we see right away, oh, hey, these girls did not eat as well. The milking parlor is another one. The second one is, I think this is so interesting. There's a dairy in Ohio. They published a paper about this now. 4,000 cows milking. So the dairy was clinical end of March. So they went back in June and they drew blood samples on 20% of these cows, I believe was the number. It was like 600 cows they drew blood samples on. Of those cows, 80% of them had antibodies. And of those cows they tested, only 20% were clinical, meaning there was this whole population of girls, cows, right, that were exposed that had responded. And the really interesting thing is in these cows, the cows that are dry, right? So she's not making milk. She's on her 2-month vacation. She's near the milking cows, but she's not with them. 40% of those cows had antibodies as well. So they responded. They saw the virus somehow. This is where this whole respiratory transmission question comes into play. So we also saw it, like Dr. Klein-Hines mentions, Klein-Hines. We saw it. We have these girls that have the Fitbits and they have collars, and you see this drop in rumination, right? Their rumen basically like bottoms out to 0 temporarily, and it goes back up. We saw that in dry cows too, at the same time that milk cows were sick on the same dairy. So there's all these factors, and the only other thing I will say is if you don't test, you'll never know. And I don't know of any beef cattle samples that have been tested.
More questions? Okay, fear not. I have some from the internet. We're okay on time? Okay. Let's see. This question is to everyone from animal control. Should the parks in New Braunfels, where the black buzzards have learned to feed out of trash cans and dumpsters, be disinfecting the areas as much as possible?
Ideally, yes. I know that's hard. Kind of like any wildlife, making your dumpsters as wildlife proof as possible is nice. Again, anything you can do to reduce congregation and disinfect would be fantastic.
Washing your hands too afterwards is highly advisable.
Generally excellent advice. The next question is from Sharon to everyone. Is there a huge concern for residential areas in San Antonio that have a very high population of feral cats?
So when they say concern, like human exposure or wildlife?
Sharon, if you're
cats?
listening to this, maybe you could clarify your question for us.
I guess we can answer all three. So there have been, to my understanding, feral cats have been positive in San Antonio. So yes, it's out there. But again, rabies is also a differential too. But yeah, if there's feral cats outside, they're going to be eating birds. I mean, that's a fact. Cats cause like 3 billion bird deaths a year, and so they are in the thick of it. If they see a sick bird, they're going to go for it. And a feral cat colony, if they're being fed, that's another congregation center where they can spread it to other cats, unfortunately. And so, yeah, that's a problem. And then, of course, if people are interacting with these cats, let's say you have a semi-friendly one, that's an exposure point for a person as well. So, yeah, those opportunities can lie in those feral cat colonies. Is there a ton of research looking into that? No, but there have been positives in feral cat colonies.
Probably for any city, right? If you have an animal control program, I would definitely reach out to them and ask them to support if you're observing animals that are not well.
Okay, thank you. Thanks, Sharon. Next question says, is this information something we should be bringing to our primary care physician's attention only in certain regions? The clinics in my organization typically provide, is this like for the correct panel? Okay. Sorry, I'm not quite as familiar with this area. The clinics in my organization typically provide POCT, such as rapid antigen influenza AB tests or COVID-19 rapid tests.
Yeah, we encouraged, so when we had humans that were sick, we would encourage them to let whenever they went to a walk-in clinic or wherever they're going, I think they're talking about point of care testing, and say, hey, I work with cattle, right? Or I work in a poultry barn. Just let them know that you work with animals. And that may or may not trigger something for our human NUMDs. Or even, I don't know about, we have walk-in clinics, but even if you presented to, say, the emergency department, because some people do primary care at the emergency department, remind them as well that you do work with animals.
Okay, the last question I'm seeing regarding the subject, Would testing peri-domestic animals such as mice and songbirds be useful in looking for virus reservoirs during the warmer seasons?
So there is some ongoing research with USDA now where they have been looking at mice. The positives that you'll see on the USDA website were caught mice, not clinical mice. And so that does happen. And then as far as the passerine birds, so some bird species, like I mentioned earlier, are more susceptible, but then some really aren't at all. And passerines outside of ravens and crows being those birds. So your little songbirds, like chickadees, cardinals, things like that. Statistically, they're very, very, very low risk. I think I've seen a couple of sparrows listed, and I know Dr. Kleinhold, you educated me about doves and how doves, for example, and pigeons.
Doves and pigeons, yeah.
Mhm.
They just don't shed the virus. I mean, they can be exposed to it, but like we'll get a lot of doves and pigeons in asking for AI testing, and I don't remember all the details of it, but they're just a specific bird that they don't shed in a high enough quantity. And going back to that test validation that we talked about, a lot of our testing is validated based off of a certain like threshold of organism. And so if they don't have the level of organism for detection, it could easily go as a false negative.
Yeah, so there are certain species that are focused on a little bit more as far as what they can do for moving the disease around and against spillover opportunity. So the peri-domestics, probably the ones to focus on would be your grackles, blackbirds, things that are typically living out in those dairy farms and staying there all year round. It doesn't necessarily have to be seasonal.
Okay, that's all the questions on the subject that I see. Would y'all like to answer the question about whether this webinar will be shared? Excellent. Then for our panelists, any closing remarks?
I don't have any closing remarks other than if you have questions, that's what we're here for. That's what our job is, to help, protect, public health, animal agriculture, and like animal welfare in general.
Yeah, this is One Health in here right now in this room. So thank you for coming. It really, really means a lot to be able to share what we've learned, what the questions that we're asking, the things we want to learn about this. And I think we're going to learn a whole heck of a lot. And the only thing I think I'll expand upon is the question about vaccines. I just think there's more that we can learn about the immune response, thinking about those girls, those cows that were subclinical, why didn't they get sick? That's what I want to know. So I think we have so much more to learn. So I look forward to sharing all that with you as we learn this together.
Yeah, and little events like this, they help create partnerships, which we've all talked about in all these panels and the presentations earlier. And so, thanks everyone for coming out here on your Tuesday? Monday? Tuesday. I've been traveling. And for listening. And again, yeah, if you have any questions, don't hesitate to reach out to whatever agency that question's for.
All right. Thanks so much to our panelists.
Yes.
For all of the panelists that participated today, I've been asked that you stay at the end for a group photo, if you'd be willing to do that. And I'm going to pass this over to Dr. Milton, who's going to close things out for us today.
Sit down or stand up or right here. Okay. Hi, everybody. So I'm Scott Milton. I'm the Texas Department of State Health Services Regional Medical Director for Region 1. And so it was our team, Dr. Abdul and various other members here, who actually were the team that diagnosed the case of H5N1 in our region. The first one in North America, and it was published in the New England Journal. And I had a chance to examine that individual, and Veronica took the sample, and Dr. Abdul and I took the picture, which is still on my phone, which is right here. And so that was the first case of now about 70 cases that's been described of H5N1 in this country. What was so alarming about that is that if you look historically at H5N1 that was first described in the mid-1990s, it has about a 50% mortality associated with it. There's been around 1,000 cases that have been documented since that time, I think. And so when we sent this sample off, and it went to Dr. Webb's lab and then on to the CDC, we were contacted late at night, and the first question was, where is this guy and how is he doing? And I have to tell you, this gentleman here, we never got his name. We never knew where he lived. We knew that he worked on a dairy, probably in Castro County. We collected the sample in Hereford. So it brings up a lot of different issues from the human side of One Health that I just want to make sure that is said here. And it was a very complicated process to try to get this information, and we know very little still today about the risks involving the dairy workers on those facilities. And to be blunt about it, it's because we really weren't able to get much access. And so I think that there's a lot of questions that need to be answered still. Why did this gentleman develop just conjunctivitis and not develop lower respiratory tract disease? We don't quite understand that. This guy was really not even that sick. He never even stopped working, as far as we could tell. And so it's been a big mystery. But as Dr. Bell and others have alluded to, this virus is mutating and changing and will continue to change and evolve, I think. And we have had, of these 70 cases, we have had some severe cases. We've had one death. We've had others that have been very sick and with severe pneumonia. So I think that was one of our biggest challenges, at least from my point of view, was trying to understand what the risks were to the workers and what continue to be the risks to those workers, and try to give them the best environment they can possibly be in to minimize that risk, to mitigate that risk. So I think that we had some challenges, and but I think that we were able to work as best we could on improving the coordination and trying to make sure that the data was shared well. If you think about it, data from the USDA and the CDC, they have different data sets. I mean, just from the very start, that in itself was a challenge to try to merge those and get the data that was able to be evaluated by everyone. And I think that as time going forward, I think we're better at that. But I still think that there are going to be challenges. We're going to see more cases, I think, and as as some people have alluded to, I think there's a good chance that it may end up being a real problem with human health down the road. I mean, and there may be, sure enough, a pandemic that could present from this. So the more we work at it, the more we learn more about that, I think we can mitigate that risk. So that's about all I have to say. Thanks. Okay.
All right, everyone. Well, thank you for coming today and attending the Zoonosis Program first ever CE event. I'd like to extend a special thanks to all our panelists, those that came all the way from Austin or even just in our backyard, whether it's here in Amarillo and Canyon or from Lubbock. I wish you guys a good afternoon. Have a good day. And until the next time.